Some of us have no clue whether our hearts are fine or about to fail because we don't know about those silent signs that show the heart is in danger or because we ignore them. There's a saying that you should always listen to your heart, and in the real sense, this is correct, and not just figuratively, but literally. You need to listen to your heart when it gives some danger signs and warnings before serious issues arise by paying attention to even the tiniest details so you can seek prompt medical attention. So, take a deep breath, relax, and don't get anxious while checking out these 7 warning signs because anxiety can also stress your heart. Number 7. An irregular heartbeat. It's normal for your heart to beat faster when you are anxious or excited, or skip and add a beat once in a while. However, if it persists for a prolonged period of time or if it happens frequently, it's a sign. So, inform your doctor about it as soon as possible. It is best to take preventative measures with regard to your heart health right away in order to lower your risk of suffering a cardiac arrest in the future. Strokes, cancer, and a number of other illnesses can be caused by an irregular heartbeat. And mind you, if your heartbeat is slow, that's also an irregular heartbeat. So, whatever the unusual and frequent change in your heart's rhythm, check in with your doctor. Number 6. Pain. One very common pain that stands out as a sure warning sign is chest pain. So if you feel pain, tightness, or pressure in your chest very frequently and it lasts longer than normal, then it's time to visit the hospital and get checked. The pain develops as a result of the heart not receiving enough blood or oxygen, and each person experiences pain differently, as some may experience a crushing ache while others may just experience slight discomfort. Some also experience referred pains like stomach pain, pain on the left side of their body, swollen ankles and feet, and sudden migraines. People, especially women, may experience the tightness or pain in their left arm or jaw instead, and some experience back discomfort. The bottom line is, if any unusual pain persists, go for a checkup. Number 5. Extreme fatigue. Heart disease can cause extreme fatigue or unexplained weakness that lasts for days. Up to 40% of people with heart disease are thought to experience tiredness. It is one of the most frequent symptoms patients report. So, assess your health. Do you feel worn out and exhausted every day? If yes, it is a sign. And although many factors can contribute to fatigue, sometimes it merely indicates that you require more sleep or have done a rigorous amount of work. But if you haven't done so much and you start to feel exhausted, it can be a sign of a more serious issue. It is a way the heart communicates that there is an issue. So, if you have a lot of fatigue than usual, or you are so worn out that you find it difficult to perform your regular tasks, or you have experienced an abrupt, terrible exhaustion and feel dizzy or lightheaded frequently, call your doctor right away. Number 4. When it becomes difficult to breathe. Blood backs up in the veins that lead from the lungs to the heart when the heart can pump blood as efficiently as it should, and you find it difficult to breathe. This is one of the critical indicators of cardiac failure. If you experience trouble breathing during activities as you are sleeping or when you are flat on your back, then there's a problem. Give your doctor a call and let him check you out. Orthopnea is one of the most typical symptoms of heart failure. It can be characterized as being unable to breathe while lying down or as shortness of breath. People with this disease frequently need to use pillows to support themselves while they sleep at night, since lying flat may make them feel as though they are drowning or suffocating. If you are battling with this, it's time you went for a checkup. Number 3. Snoring. Snoring a little bit as you sleep is normal. However, snoring that is excessively loud and sounds like gasping or choking may indicate sleep apnea. If you experience this multiple times throughout the course of the night while you are still asleep, it means your heart is giving you a sign. People with obstructive sleep apnea frequently snore and occasionally stop breathing while they sleep. An increased risk of heart attack or atrial fibrillation, a type of heart arrhythmia, has been linked to this sleep disorder. In order to increase oxygen supply to the heart and brain, people with sleep apnea's body stress when their oxygen levels fall during sleep and tell blood vessels to tighten, causing breathing to become more difficult. Number 2. A cough that won't quit. This typically doesn't indicate a heart problem, but be particularly aware of the danger if you have heart disease or are aware that you are at risk. If you have a persistent cough that generates white or pink mucus, it may indicate heart failure. So, ask your doctor to examine the root of your cough. Number 1. Narrowed blood vessels. Your chance of having a heart attack may significantly increase if the blood vessels that carry blood to other parts of the body are narrow. This can happen when plaque, a buildup of fatty substances and cholesterol, develops on the walls of your arteries. These conditions can lead to several conditions as a result of inadequate blood flow. Muscle aches, pains, exhaustion, burning, or discomfort in your calves, thighs, or feet are examples of symptoms, as well as legs or feet that feel numb when you're at rest, or your legs could feel chilly and have pale-looking skin. Heart disease is one of the most preventable illnesses when treated at an early stage. And one thing is for sure, the heart always gives a sign, no matter how subtle. You just need to pay attention and be proactive when these symptoms persist. And if you need more tips on how to take care of your health, check the description box for a book titled Prevent and Reserve Heart Disease, the revolutionary scientifically proven nutrition-based cure by Caldwell. And don't forget to stay healthy. See you later.